Okay, so we're gonna go through a couple things, just try to bang this out real quick because most of it you're already pretty much aware of. And then we're just gonna make some modifications of some old fun things, and we're gonna get this trap situation under control and just nip it in the bud, okay? So first things first, the pec stretch. You've done it a million times, you know how to do it, but just to reiterate specifically what we're looking for, grab a wall, bring your arm up high, and you're gonna, let's see if you see, yeah, okay. So I would lean forward, you're gonna drop a hair, and kind of tilt forward. You can kind of lift up. You might even want to bring it down this way. You can get some rotation going, so you're kind of trying to point behind you the whole time. Really, just trying to stretch this bad boy out. And if you get the pec minor, that's money too. Hunt around, find what you need. 2 minutes, both sides. Okay, number 2. So I know that you've been doing cat camels, but we're gonna do a little bit of modification in there, okay? So just to put it in words, what we're gonna do are cat camels with rib flare, some upper thoracic and cervical end range work with elevation and depression. Lots of words. What that looks like is, I'm gonna move this over here. So quadruped, your very basic cat camels, right? You're gonna extend and round out, extend and round out. Actually, I don't think you can see scaps moving because that's the important part. Okay. So those are basically what you have been doing, I think, but what we're gonna add are the kind of like a rotation element. So you're gonna actively use your scaps. You'll pull yourself forward, push away, really round out, and then come back. Make some nice circles. Round out, extend. And the whole idea is to basically get your scaps to be moving in every possible direction as far as it can, and then we're gonna go the other way, right? So if we were going this way before, try to go the other way. Again, while flexing and extending. I know it's a lot of coordination work, but it'll take a few times and you'll get it. Eventually, probably at the first or second time, and then the other part is, I want you to be tucking your chin and then bring it out. Tuck your chin, bring it out. So when you're in here, really tuck it. Really try to actively tuck the chin, bring your head down, push away, bring it back, extend through the whole thing. Oh, yeah. And this can be done very slowly. It does not have to be fast. When you feel your traps acting up, don't go in that direction. Do the opposite. You might find that one motion is not the greatest for you. You might find the other motion is perfect. Skip the ones that hurt and go into the ones that feel good. So, the other thing is, you can have your arms out here, you can have them here. The whole idea is just to get motion. You're not really trying to like exercise or like stimulate anything. This is just to get you moving, right? Okay, quadruped thoracic rotations. So while you're down here on all fours, you may as well go right into your rotations. So what that's gonna look like is quadruped, hand under head, and you're going to bring the elbow as far this way as you can. So this way, really rotate as much as you can. Bring your head down and just stretch all of this. You can reach up and forward, you can reach down and back, and then you're gonna come up, look up, do your best to not put too much pressure on your head while you're looking up so you can actually look up. Kind of pause in there, come through. Yep, that's something I gotta do. I can actually feel it cramping up there. Again, you're not really trying to contract really hard. This is just a nice light motion, and the only thing I want you to focus on, 2 things, is get your motion, but also get a little bit of extra range of motion but every couple of reps or so. Yep, my back's already loosening up. Oh, it's my rib dynamics going on right now. Okay, so that's your quadruped thoracic rotations. What that's gonna do is gonna help unlock your upper T, usually at about this level, the T3, 4 area, give or take, has a tendency to really get locked up, and then everything else has a stable position to pull from, which is great for moving heavy things or really just holding your head in place in general. But the problem is when you have a painful sticky joint, subluxation, whatever term you want to use, the adjacent joints, either superior or inferior to it, tend to get a little more hypermobile. So you might find that your neck is hypermobile, mine certainly is, but the upper back is just like toasted and locked into place. That happens to be a thing with powerlifters because that's where most of our force transfer comes from. We're trying to transfer the deadlift forces from our hands to our bodies, specifically the lower body. What's the first thing it goes through? Arms to the shoulders, which are intimately related to the upper back, and it has to be super stable so that it can basically push all the forces through and transfer all those forces. I don't have to tell you that, you know all of that stuff. And then where are we? And I still have to name these. I guess we'll call them the serratus pushes. I don't know. These I actually prefer to be done standing up. Well, actually, can we do it on the floor? Does that make a difference? No, because you need both hands. Never mind. Okie doke. I'll just go through my notes real quick one more time. Chin retraction, serratus, elbow forward. Okay, so the cue for this is going to be try to bring your scapula on this side to the shoulder on this side, right? So basically, what you're gonna do is take the side that's extra painful, plop that hand on the back of your head, right? Just very traditional back of your head. Take the other hand, you're gonna find your serratus, which is that like fingery guy that goes like this. It might be lower. Anatomically, it was slightly different for whatever reason on this one. So, you see, notice how I'm abducted? You're actually gonna adduct it, kind of bring it forward into this like 45 to straight on 90-degree angle situation. And so with this hand, you're gonna kind of palpate and just make sure that you really feel your serratus so that you know that it's firing. That's the whole point. And what you're gonna do is you're gonna take this elbow and try to punch it forward and up. And what this is really going to do is take this area and wrap it around your ribs, and it's going to kind of posteriorly tilt your scapula, and it's going to put the traps on long. And what it's going to do is we're trying to teach your serratus and other muscles that can take up the upward rotation that the upper traps need to do. The area that you marked is painful. Basically, we're trying to get them to do the same job so that the traps don't take the brunt of it, because when you got one muscle doing all the work and everything's not stabilized, you get problems, especially when you're a student. And this is actually one that I do literally all the time and while I'm driving, which probably shouldn't be doing, but whatever. So, one more time, hand behind head, bring it forward, touch the serratus, and you're gonna bring it forward and up, and you should feel it here, right? Bring it back, relax, or sorry, retract. It's gonna be an active retraction too. Nothing too hard, just kind of bring it back. Then push really hard, forward, and bring it through. So forward, and bring it through. Scap to shoulder. Scap to shoulder. And I can feel this one firing really hard. This one, actually, I don't know if you can see a difference because I've been struggling on this one. So we'll learn together. There it is. You might also have to like kind of shift your body that way. For whatever reason, that kind of helps out. So elbow up and forward, up, forward, one fluid motion, bam, scap to shoulder, scap to shoulder. 1, 2, 3, bring it back. 1, 2, 3. And it's totally okay to round out a little bit. The final part to this motion is you're gonna actually kind of actively retract. You're not extending. You don't want to extend. What you want to do is bring your chin back. Make the double chin the really nasty thing, right? So what it looks like all together from the front. Head behind back, hand behind head, right. Elbow kind of forward, touch the scap, bring your, either think elbow forward and up, or conversely, scap to shoulder. So it's gonna be blam, 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 blam. Now we're gonna add in the head, bring it back. So we're gonna actively here, and then we're gonna bam, bam. You make a weird noise because your throat's kind of closed when you do it. And then from the front, it's gonna be elbow forward, bam, with the head retracted. Maybe you can see this side. Is this better? Yeah. Forward, head back, relax. Scap forward, head back, relax. So what I want you to do with these are push really hard, count 1, 2, 3, then bring it back. Go forward, 1, 2, 3. Let's start with 2 to 3 sets of 10. You can do these any time of day, any day of the week. I actually tend to do these before bench and OHP and before squats, not usually before deadlifts. And these are done generally immediately after your pec stretch stuff, so just to inhibit everything you need to inhibit. And then the last thing, I just want to make a quick note. This video is already 12 minutes long. I'm sorry, I'm always long-winded. I gotta work on that. At your gym, grab a really, really light band. The ERs that we're looking for, I replaced your face pulls, right? So instead of doing ER here, I'm actually gonna have you doing it like here. And one thing you can do is take a water bottle or something relatively thick that you can put under here. And you're gonna grab, well, actually, I take that back. You don't need the water bottle because you're gonna have both hands. Grab the band, bring your scaps back and slightly up so that your elbows aren't gonna really be able to touch your sides because your scaps are up and tilted back. You grab the band and you're gonna really actually rotate and bring that chest through, and you're gonna kind of have everything rise, and that's the whole point. So it's like a, and then from the front it's gonna be like a, the important part here, again, retracting, retracting. So really want to down-regulate that bad boy. Sorry for the length of this video. I had to remake it because for whatever reason the other one didn't want to upload. Hopefully this works, or uploads. If you need help with any of this, you know the drill, let me know, we'll figure it out.